Today we're going to do a little bit of some neck work. So I wanted to first kind of give you the disclaimer again from the same thing as last week, that not all neck pain comes from the same source. It could be from your neck or it could be from somewhere else in your body. So we're going to go through kind of the basic range of motion of the neck because there is a lot. And then we're going to go over a muscle release for your suboccipitals, which I did on the very first week, but I find it super, super important and a really good release with the lacrosse ball. And then with the towel, we're gonna do just another range of motion kind of exercise. Typically what I see in the clinic, a lot of like postural kind of issues, I guess you can say, or postural related issues. So let's go through the range of motion first, and then we'll see which range for you guys is the most limited. So there's flexion and extension. So if you're sitting down, legs crossed, what you want to try to do is bring your chin down to your chest without opening your mouth. So keep your tongue on the roof of your mouth and see if your chin can touch your chest. So if it doesn't, then you're limited in flexion. And then extension is going straight up. So if I were to, I typically would look at it from the side. So you want it to be a smooth movement, looking up to the ceiling. And I mean, what you guys can do on your own, because obviously it's hard to look at your own range of motion, is just set up your camera and just record and go through these motions and see where you're limited. So with extension, you're looking to see if there's any discomfort in your neck when you look back. And then from my perspective, I'm seeing if your nose is parallel to the floor. So both of those things are kind of what I look at. And then on the way back, when you come forward, I'm looking to see that it's a smooth motion right on top, like your head is right on top of your neck. So if I'm going back, I'll show you good, and then I'll show you bad. So good is looking up and then looking straight again. And then bad would be this and then like that. So I probably exaggerated that a little bit, but it's basically when you're bringing your head back to neutral, your deep neck flexors, they're in the front here, they have to engage to pull your head straight back on your neck. The superficial ones will engage if the deep ones are weak. So when the deep ones are weak, it looks like this. And when the deep ones are strong, it looks like that. Does that make sense? Can you see the two differences? So I encourage you to videotape yourself doing it and see if you just do it without thinking, and then do it with intent and see if you can bring your head back without. Yeah. So Brigitte, I would say yours, you're pulling your head forward a little bit more than what it should. So it should kind of sit like right on top, versus think of like a plumb line. If you had a string straight down your spine, or a pole, and you're bringing your head right back on that, that's kind of what you should be doing. Yeah. So we'll go through a deep neck flexor activation in a few minutes. But that's a really important factor, the strength and endurance of those deep neck flexors for neck pain. And there's been lots of studies done showing like weakness in that correlates to poor neck function, basically. Okay, so let's go through the other ranges. So rotation is just turning from side to side. So it's a little bit hard to see on yourself, again, if you recorded yourself from the side. Your chin should be in the middle of your collarbone. So I'm looking from here. You should be able to turn your head without tilting. So a lot of people, they'll kind of turn here, and then to get to the rest of the way, they'll tilt. So that's also incorrect with range of motion. Yeah. So a lot of that can be tightness from up the base of the head, and you're lacking that rotation potentially, which is why people will tend to tilt. So turn the other way, see if it feels the same. Just see if you feel any discomfort or tightness in either direction. Yeah, so both of you are kind of tight in that direction. So that's the one we're going to use with the towel, because that's the most common direction that I find people are limited in. And then the last, so there's two more. So side flexion is this way and this way. So you're basically looking to see if they're even. Most people are going to feel a pretty big stretch in their scalenes and upper traps there. Sometimes you can feel pinching on the same side if you're going that way. There can be lots of different reasons for that, but we'll kind of stick to the basics right now. And then the last one is flexion and rotation. So it's a combined movement. So you're going to try to bring your chin to your collarbone without shrugging your shoulder and without opening your mouth. So keep that tongue on the roof of your mouth, keep your shoulders down, and then see if you can touch your chin on your collarbone. Okay? So if you can't, then limited as well. Watch that shoulder shrug. Everyone does it, and it's so, because it makes it so much easier. But yeah, so you should be fairly, so you should be symmetrical first, and you should be able to touch all those spots and little landmarks. Okay. So the one with the towel, it's basically a range of motion exercise, and using the towel just helps assist that movement a little bit. So you're just gonna grab your towel from the edge. So hold the one edge, and then you're gonna flip that around and hug the base of your head. So where the head meets the top of the neck, you're gonna put the towel there, and then you're gonna bring your hands together, and you're gonna switch hands. So the top hand is gonna go, yep. Okay, so both of you, I think, are going in the opposite directions. So your top hand, whatever your top hand is the direction that you're gonna turn your head. So I'm holding with my right hand, so I'm gonna turn right, and then this bottom hand is just gonna stabilize, and the top hand is going to pull my neck into right rotation. So yeah, let's start that. Yeah, so Brigitte, you got that right. So swap hands, Janet. Yeah, and then is that your right hand on the bottom? Okay, so just bring that hand down, and then you're gonna turn your head to the left. So you're turning to the left, and then you're gonna pull the towel to give you a bit more range of motion. So you wanna try to keep your opposite shoulder, so your right shoulder back, because you don't want your whole body to turn. You want just your neck. So you're almost like resisting and trying to turn your opposite shoulder back so it doesn't come with your head. Okay. So again, you just, whatever direction you're turning, that's the side that you want to grab the opposite side to help it turn that same direction. So Brigitte, I would maybe put your towel a little higher on the back of your head. Yeah, you can even grab it like this too, just whatever gives you more friction. And then you're just kind of pulling, and the direction of pull is just straight across. So Brigitte, switch hands.
Strangling myself.
So switch. So you want to start with your arms crossed. Yeah, there you go. And then you're going to turn the other way, Brigitte. No. So, okay. So let's start again.
I had it the first time.
I really like this one, so I want you guys to get it. So just wrap the towel like this.
Yeah.
Okay. And then, so Janet, you want your opposite hand to pull. So, and then cross your hands like this. Yeah, yeah. So cross your hands like this. Whichever hand is on the top, that's the direction you're gonna pull. So that if your right hand is on top, you're gonna turn your head into right rotation and pull with your straight with your right arm. Yeah. So Brigitte, try to keep your torso facing me and just turn your neck. Yep. And hold the towel a bit higher so it's pulling straight across. So see how my arm is straight and my line of pull is directly in line with the towel. Yeah, there we go. And then, yep, so if you're going to switch sides, you have to switch arms and then pull in the other direction. So once you get it, it's a really nice stretch and added. And so you kind of want it to be, you want to start actively turning your head, like use your muscles and bones and joints to turn your head, and then give that extra added pull at the end. Okay, good, awesome. So I'll send this to you guys afterwards so you can refer back to it, just so you don't get the hands mixed up. Okay, so we're gonna use, I just need you to go into the doorway. So we're gonna do just the corner of the wall. So Brigitte, you can actually use the corner of that, the siding there. And then if you just open your door, Janet, or find a corner of a wall, we're just gonna do a chin tuck exercise on the corner of the wall. So the purpose of, yeah, so you want to be, can you hear me okay if I do that? Okay. So you want your spine to line up with the corner of the wall. And you want your sacrum, so kind of tailbone area, and your whole back against the wall. And so what you're going to do is a chin tuck. So from the side, the chin tuck is basically this. So I'm retracting my neck. I'm not doing a double chin this way. I'm just bringing my chin back like that. Okay. So you want to do that on the wall without flaring your ribs. So see if you can, just like in all Lisa's classes and everyone's classes, get your rib cage down first and then put the back of your head on the wall and see if you can do that same chin tuck without lifting your chest up. So keep your whole T-spine on the wall and your ribs down and see if you can do the chin tuck. So you might feel a little bit of a stretch at the back of your neck. You should also feel kind of like contraction or tightness in the front. And your head almost slides up the wall a little bit as you do it. So you're kind of, you should just feel your hair kind of sliding on the wall. Okay. So just, I want you to get used to that movement because we're going to do that on the floor in a second. And it's a really small movement, but just, this gives you a little bit of feedback from the wall to not move the rest of your body and to just move your chin and your head. Okay. So let's grab the lacrosse balls and head to the floor. Okay, so we're going to release your suboccipitals. So they are, there's a whole bunch of them around the back of the head. They attach on the neck. They attach the neck to the head basically. And their main job is to rotate the head. So what you want to do with the ball is pop it. So you're going to lay on your back. And then just have your knees bent just so your rib, it's easier to keep your ribs down. And then you're going to place the ball on the back of your head. So you can guide it with one hand just so it doesn't slip or catch on your hair. And then it's basically like just find the back of your head, and then it's just in the little groove between your head and your actual spine. So you don't want to be right on the spine, you want to be beside it. So you'll feel, I'm sure as soon as you put the ball there, you'll feel the spots, but you can, depending on where you're specifically tight, just move your head around a little bit on the ball. So you can turn your head from side to side, just little turns, like little nodding. And then you can, like saying no, and then saying yes. So you'll feel, you can see which yes or no feels worse, and work through those tight spots. So just take a minute. You don't have to turn your head or nod it. You can just keep your head on one spot, or keep the ball on one spot. And just breathe. Pay attention to which side feels worse or which area feels worse, because that potentially could be contributing to the range of motion restriction, especially the chin to your chest. So we kind of separate the upper neck and the lower neck. What typically happens with people is that their upper neck gets kind of stuck in this extension position. And so with the ball, when you nod, you're working on that chin tuck, but also kind of stretching out and releasing any tension in those muscles into the opposite direction that we're typically in. Okay, so you can practice that one later on as well. When you take the ball away, you should feel a little bit lighter, a little bit looser. And just in this position, we're gonna work on those deep neck flexors. So I'm just gonna grab my timer. So I typically, with anyone that comes in the clinic with neck pain, I will typically do this muscle test. It's an endurance test to see if they can hold their head in this position. So you're gonna be, I'll kind of explain it quickly first. You're gonna be laying on your back, and you're gonna do that chin tuck first, and then we're gonna lift your head. So the most important part of this test is the chin tuck. So I encourage every couple seconds to re-tuck to make sure that you're still tucking, because it's easy to let it go if the muscles are weak. It's harder than it looks. It's a very small movement, but you're going against gravity, so, and the weight of your head. So we'll start on your back. Okay, so just maybe watch me first, because it's like a super small lift as well. So you're basically tucking your chin just like we did on the ball and against the wall. So you should feel a little bit of a muscle contraction underneath your throat, or on your throat basically. And when you tuck your chin, you want to make sure that your ribs don't lift as you tuck. So just keep a little bit of a brace, nothing like 50% contraction. And then from here, you're just going to lift your head a tiny bit off the floor. So you should see a little space, but I'm not lifting all the way up here. And you're still kind of looking at the ceiling. So your chin is tucked, ribs are down, and then you're just lifting a tiny little bit off the floor. And then we're going to try to hold that for 1 minute. Okay, so I'm going to put my timer on. I'm just going to watch you guys. I'll tell you when to go. So go. Watch. Okay, so tuck your chin. Yep. And then just lift a tiny bit off the floor, and then hold there. So I'll give you your timing milestones. You just focus on keeping your chin tucked. So maybe every time I give you a milestone number, you just retuck your chin. Just make sure that you're still lifting it. So you're at 20 seconds now. Brigitte, just lower your whole head a little bit, but keep the tuck. Yep. And you're at 30 seconds. Good. If there's pain, obviously come out of it. But if it's just muscle fatigue, then I encourage you to try to keep going. You're at 50 seconds. Keep tucking. Tuck, tuck, tuck. Yeah, there you go. 56. So Brigitte, you stopped at 56. And Janet, that's 1 minute. Good. So overall, yeah, harder than it looks, right? So I would say holding that for 1 minute should be easy. So you should probably do that as an exercise if it feels uncomfortable. Like you should feel it in here, like the front of your neck. A lot of times people will feel it in the back of their neck too, because they're super tight and those muscles aren't used to that position. But I mean, everyone's going to be a little bit different. Jaw. Yeah. So if you're practicing it next time, you can put your tongue on the roof of your mouth. Don't clench your jaw. Keep your teeth spaced apart. And it should be better over time. Like it's an endurance exercise. So I probably wouldn't encourage like going to failure every single time you do it. Maybe break it up and do like 4 sets of 25 seconds just to get up to that same minute, but you're giving yourself like a little bit of a break. And again, you can make that as many increments as you need. But the key is that you're not letting the chin tuck go, because then the superficial muscles take over, and then the deep, you're not really doing anything for the deep neck flexors. So if you want, you can unmute and